So my clinical bottom line was on instrument-assisted soft tissue mobilization and range of motion. So just the introduction, when we think about instrument-assisted soft tissue mobilization, so these are just tools of varying angles and shapes and sizes that are used to treat various soft tissue dysfunctions or pathologies. The material that usually comes with these tools is they're either in wood, ceramics, plastic, or most commonly stainless steel, or in the Graston form, as we all know about. The unique angles and grooves that these tools have allow a clinician to locate various restrictions within the soft tissue. And most commonly, these tools are used for range of motion, pain control, motor control issues, and any sort of muscular recruitment deficits. Pathologies that are commonly used for or used with this tool include various tendinitises, especially patella tendinitis, any sort of chronic sprains or instabilities, which we'll see later with the ankle, and also any post-surgical scarring that we also take care of with this tool. And it's also a really versatile tool. It's able to be used for any upper or lower extremity type pathologies or dysfunctions. When we think of the physiological response and how the tool actually works itself, we base it on the inflammatory response of the healing process. So while the clinician locates these various restrictions within the soft tissue, they're creating microtraumas within it. And with these microtraumas come this reabsorption of any scar adhesions, especially after surgery, or any just excessive fibrous tissue that is formed within the initial healing process. And again, the remodeling phase of the affected region thus begins afterwards as the fibrous tissues are able to align better after this treatment is done. So my clinical question that I researched was, for those with pain or flexibility deficits, how does instrument-assisted soft tissue mobilization help increase range of motion for upper and lower extremities? So to begin with my summary of the findings, I kind of split this up into range of motion and extensibility. So when we look at range of motion, there's kind of two parts to this research. There was the articles that looked at just singular treatment for Graston or instrument-assisted soft tissue mobilization. And then there's more of the research over time with the multiple treatments, usually over the course of 4 weeks. So when we look at the singular treatments, we found that ankle, shoulder, and hamstring musculature saw slight benefits after one treatment of Graston, and especially with dorsiflexion of the ankle, extension of the shoulder, and knee flexion for the hamstring. Those motions were more significantly seen as opposed to other motions within those joints and for those muscles. When we look at more research that's more over time and multiple treatments, for chronic ankle instability, researchers saw that range of motion was increased when combined with other dynamic stability programs. But with Graston and the program combined in itself, they saw more significant results, especially in dorsiflexion. And also another research that went more extensive would be individuals with chronic low back pain. They saw significant increases over time throughout the course of this 4-week research period. And they saw increased range of motion for any sort of trunk flexion, extension, and bilateral trunk bending as well. When we look at extensibility, research has shown that flexibility in individuals with any sort of hamstring tightness that was evaluated using the sitting trunk flexion meter, they also saw the benefits as well. And both of these studies as well were a singular treatment. When we look at the gastrocnemius as well, the researchers saw that muscle elasticity and stiffness, there was very good improvement with those as well throughout the course of the study. And that was evaluated using a Myotin Pro device, which is able to accurately measure the muscle firing and being able to calculate various the muscle elasticity or the sort of structure of the muscle itself to evaluate the stiffness. And another study that I found was valuable was to see if the pressure applied from the clinician on the tool itself had any effect on the results. But it showed that in this study, when they evaluated the hamstring, there was no difference between using a more moderate type of pressure and more severe type of pressure. As far as limitations with these studies, I found that a more uniform research design would be beneficial. As I was going through them, some chose to do the whole Graston protocol with the warm-up, stretch, and then the application of the treatment. However, some articles were had their own sort of protocol, so they might have had 30 seconds on with the treatment, 30 seconds off, and kind of just going back and forth like that. And again, more research needs to be done for using this Graston or instrument-assisted soft tissue mobilization over a longer period of time. I felt like most of the studies that I was able to find were more one and done treatments. And I felt like it would be more beneficial to have more treatments over a lengthier period of time to see more results. And then again, I was thinking of more sport to sport studies, being able to really group athletes together within the same sport to see how that would affect it, because different sports have various demands on the body or different ranges of motion. So I would just be interested to see how this Graston would affect athletes within multiple sport disciplines, which I did not see in the study. It was maybe one or two studies that group athletes with just baseball or just soccer. And for my clinical bottom line, overall, instrument-assisted soft tissue mobilization is able to increase range of motion for individuals with any sort of pain or flexibility deficits, even after one treatment. However, the benefits are more significant and realized after multiple treatments were done, as seen with the chronic ankle instability research and the low back pain. As these research times went over the course of more weeks, the clinicians found that their results were improving with each and every week they were doing the treatment. And also is important to note too, the pressure that you apply the tool with has shown no effect on the results that you get. And then also one important thing to note here is that the results of using this treatment with conjunction with other modalities or exercises like that chronic ankle instability research, where they had a dynamic ankle instability program on top of the Graston, showed the most improved results. So it's just important to keep that in mind too, that using Graston or any of these instrument-assisted soft tissue mobilization tools with conjunction with other modalities or exercises is the most beneficial. And then again, just more research has to be done that has more consistent treatment times, protocols, and research lengths. And those are my sources, and that concludes my presentation.